after obtaining a court order only, the child will be handed over to the parents. The documents required, some of the essential valid routine documents: identity proof, 4 copies of photos together, marriage certificate, cause of adoption, their recent HIV and hepatitis B report, recommendation letter from free resources, any other if required by the court. So these are all the documents they have to submit. So this is how the adoption process goes. Initial application, their application will be assessed for suitability. They will search for matching parents and matching child. There will be interviews and visits between them. They have to wait for some time for the approval. Then they can meet the child. Then legalized adoption takes place. The new life starts. So this is how the adoption procedure goes. Next. So there are laws governing adoption in India. Hindu Adoption and Maintenance Act (HAMA), which was enacted in 1956 as part of Hindu Code Bill. Juvenile Justice Act under Parents Protection of Children 2015 and Guardian and Wards Act 1890. So these are all the acts which govern child adoption procedure in India. So the fundamental principles of adoption is it is based on child's best interest. In every aspect, the children are considered as most important. Their care, their priority is at most. Child is the center of all policies and programs. Child's own socio-cultural environment as far as possible. When the child is adopted, maximum they look for a own culture, own socio-economic status. This is how the adoption matches are done. There is transparency and ethical practices. It is legal and confidential. Out of all, the most important is protection of child from all forms of neglect, abuse, violence, and exploitation. So you must have heard a lot. You must have read so much in the newspapers. How much child trafficking, child neglect, child labor. So this is like a illegal thing. So that must be avoided. Protect the children must be protected. This is what the fundamental principle of adoption is. There are some do's and don'ts in adoption. Do's include it has to go through a specialized recognized agency only. The guidelines to be read carefully. It is open online and online adoption registration is also available. Under KERA guidelines, every guidelines are very clearly stated. Before anyone registers, we have to go through the guidelines very carefully. Follow the steps in completing the registration. Upload only relevant right document and refer Schedule 13 of guidelines governing adoption of children. Always take payment through a check RD. There is some payment also required for this. These are do's. Don'ts include don't approach any nursing home, maternity home, unauthorized persons. You must have read it. A child is sold, female child is sold for this much. It happens. That should be avoided. That is totally illegal. That should not happen. Whomever you come across with, you have to tell them all these things. And don't upload any wrong documents. Don't pay additional charges. Keep away from torture middlemen. And it has to through illegal adoption only. Through illegal adoption, anyone become a member of child trafficking. Legal process will follow if illegal adoptions are done. Then, significance of adoption. Next thing. This is the statistics of adopted children from 2010 to 2020 under KERA. There are in-country adoption, inter-country adoption. If you see the number from 2010 to 2022, what trend you are seeing here? Welcome, madam. What trend you are seeing in this? Huh? I am not getting you. You see the numbers from 2010 to 22, both in country and inter country. How the numbers are? Decreasing. So you can see this. This table clearly says that there is a decreasing trend in adoption. We say it is very important. We have to promote this. But why this decreasing trend? As no, there are so many IVF failures also. There are people, infertile couples, that statistics also is increasing. Maybe one reason. Why people are ready to spend crores and crores for IVF, not for adoption? Yes.
They have this old practical thinking कि मेरा बच्चा जो है मेरे ही कोख से होना चाहिए किसी और के कोख से.
True. We strongly believe that our generation should grow. Our blood should grow. Do we say this is wrong? No, it is right. Everybody has a right now. We as couple, I have a right to bring my own child. It is my right. I will try my best till then. There is no right and wrong in it, but there is a decreasing trend. That is true. There are so many medical advancements happening that leads to people. Anyhow, they wait for 10 years, 15 years, even 20 years. We have seen couple after 25 years also they go for artificial insemination. But this is the trend. This is reality. We have to accept it. This is decreasing. What can we do to promote it? That is what we will have to focus on. Please. There are 31 million orphans in India. Only 50,000 are eligible for adoption. That's why I said a child must fulfill the criteria to be adopted. That is strict rules. There are very minimal children only eligible for this adoption process. There is a problem in fitting a child for eligibility criteria. That is what is this statistic says. Maybe IVF is the other reason. This is the major reason. Eligible children are less. Even though we have these many children, eligible children are very less in number. 49,365 Indian children are adopted from 2009 to 2020. 43.637 in India and 5,728 in other countries. This is the consolidated data. If we see the age preference of the parents, you see majority of them prefer a child between 0 to 2 years old. It's quite natural. If you adopt a child at a very young age, you can bring them up in your way. You can teach them your values. So that is why the preference also. These are all some of the factors why this adoption rates are very low or decreasing. Next. This is something very interesting. We may think that there are so much female feticide, female infanticide. We think that girls are not wanted. But this data shows that adopted girls are more than boys. From 1890 to 22, you see the number of girl child adopted by more. The preference for girl child in adoption is more. There are so much research studies required on it. Adoption goes unsuccessful also. This statistics says that 77% of adoptions are going for withdrawals. After adoption, it's a major role which should be played by the parents because it's a lifelong process. It's not a one day affair. So that is why these many failures are happening. Next. So there is a paradigm shift in adoption. The concept, the ideas, the thoughts are changing. It's from need-based to right-based approach. It's not for the parent. It is child-centered. It's not a child for a family for a child. So this is the paradigm shift which should play with adoption. Next. So the essence of adoption is unconditional love and family bonds to the child. That is what is very, very, very essential. Next one. So the dimensions. Coming to the dimensions. What are all the aspects of adoptions we have to think of? First is providing a loving home to a child. That is the primary thing. A child needs a loving home where all his needs are met. Next. It should be bond with legal and social rights. If anything goes illegal, unethical, then the problem arises. It must be done within the social integration, social system. A parent, it is not only a parent's decision. their relatives, their family members. It's a family. After adoption, if the family does not accept, there is no smooth relationship with the relatives. It will create lots of long time effects. So that is why it must be done within the social integration. It's not only the parents to be counseled. Whoever is involved with the child's development must be counseled. Cultural and ethical identity. That is why as far as possible they try for a unique culture and unique ethical identity so that the child will not have conflicts when the child grows up. Stable family environment. There are lots of problems we see with biological parents also. Divorce rates are increasing. So if this has adopted child, the consequences will be very bad. And adoption is child's basic right to live in a home. Next, emotional and psychological support. Lots of adoption definitely leads with lots of emotions and psychology. So that part to be taken care of very much. And there must be good educational opportunity for the child. Adopting a child with that it is not complete, the child must receive all developments, all needs as per the biological child. And there are so many adoption focused services that must be utilized well. There must be a permanent family bond between the child and the parent. We must create awareness. That is very much required. People think that many people may not be aware. Even at some remote places, if you do a survey and see, you can find that the awareness is less. So that is why more ambassadors to come, more awareness activities to be created. That's why Child Adoption Day is celebrated. More activities are conducted to create an awareness among the public and rebuilding trust. Emotional growth of parents. Parents also grow after that. The way how they were growing before adoption will be different after the adoption. Multicultural, multi-faith enrichment. And we have to create a supportive network. So these are all some of the dimensions which we have to look. Support by civil. Adoption carries the added dimension of connection not only to your own tribe but beyond, widening the scope of what constitutes love, ties, and family. It's a larger embrace. It takes a lot of time. It widens the cultural, ethical, tribal aspects of any family. So not flesh of my flesh, not bone of my bone, but still miraculously. Never forget a single minute you did not grow under my hand and you are from mine. Anything. A child which is not born to me calls me mother. I am her mother. She is my child. So this attachment is something very goosebumps for me. It's something very different, unique. Next. Do you want to do something beautiful to God? A quote by Mother Teresa. There is a person who needs it. This is your chance. When you are capable of, when you can do it to someone who is in need of it. Only then that help is valued. Serving poor or serving orphan is serving to God. The some of the developmental aspects in adoption, understanding psychosocial emotional implications of adoption within the socio-cultural realities. That is what is growing now, happening now. Mental health perspective. Lot of mental health involved in it. The impact of early childhood on the development of the child. And this is the sociological examination of adoption and family relationship. This is the theory, shape, fate theory. Shape, fate is already written. How many of you believe in it? You know fate. Huh? Yes, it is already written now. When we are born, everything is written. Can anyone change it? No. But this theory says we can change it. That is what the theory says. It's a shared effort. When you collectively work together, if you want to change somebody's fate, you can change it through adoption. That is what this theory says. Child is born up. Child is an orphan now. Nobody is there. If people think they can change the fate of the child, they can put the child in a family. That is what shared fate theory is. This is the theory. Okay. And please think of it. Psychology of adoption. And concept of primal wound, that is also a theory by Nancy. Actually, when the child is in mother's womb, there is a connection between the child and mother. Do you accept?
Yes, ma'am.
Yes. That connection is a lifelong process that continues till the end. But what happens through adoption? We break that. Yes?
Yes.
Directly or indirectly, knowingly or unknowingly, that hidden wound will be there on the child and the mother. That is what this theory says. So this breaking, this also needs lots of investigations, measurements, interventions to handle this. So these are all some of the concepts which we have to think before adoption. Some of the issues, concerns, and suggestions. Adoptable children must be brought into an adoption framework. There must be family-based rehabilitation, hurdle-free adoption process, avoiding delay in the process, lack of uniformity, standardization, and interpretation of norms, rules, procedures, protocols across the country, and different interpretation of CARA guidelines. I will tell you. See, when we see Indian Nursing Council gives standards for nursing education. Each state interpret, understand in our own way, according to our flexibilities we follow. But there is one guideline only. Since we are in education, we know there are many difference in admission procedure, recruitment procedure, but the guidelines are same. The way we interpret is different. So this should not happen. All must interpret in the same way so that the process will take fast. And knowledge building and capacity building activities are to be required. And clear understanding of CARA guidelines, address issues and technical difficulties during the procedure, adequate and effective communication between the ministry, CARA and state departments, focus on pre and post adoption counseling, serious interventions for child trafficking, awareness on safe surrender for the child, appeal body or ombudsman type for conflict resolution, code of ethics of adoption to be developed, more research to create policies and procedures. There are very less number of researches conducted on adopted parents and their experiences, the experience of the child. So more research will come up with new ideas that will help in refining the guidelines. What are the nurses' role in adoption? Counseling. We have the direct access. People who are eligible for adoption, we can find out, especially in the infertility centers. And respect the parents' wish. Any parent has a wish. I want to adopt a child of this color, this region, this culture. It's their wish. We have to respect it. Be sensitive to their feelings because it is a very sensitive process. We have to accept and understand. Use positive adoption language only. Explain the adoption procedure. Before you explain, you must be thorough with the procedure. Only then you can explain whom to approach, how to register, what is the procedure, how much time will it take, if any problem, where they have to go, what are the agencies for conflict resolutions. These things you have to explain them. Discourage private adoptions. That is very important thing. They should not go for any illegal process for adoption. Child examination. Before handing over the child must be examined thoroughly. Child's earliest HIV hepatitis B, child medical report, parents medical report, and you have to provide a supportive attitude to the parents and family members. So adoption in India is a tedious paperwork. Any legal process in India, you know, it is a time-consuming process. It takes patience, and there is always a bureaucratic delay. So these are all the problems with adoption in India. So support and adoptive families, there must be supportive organizations which should help because there will be day-to-day issues that is to be sorted out at the earliest to avoid further complications. Professional advice is required for them, support groups to be created, there must be lots of educational programs and maybe online resources which will help them handle the later issues, post-adoption issues. To summarize, adoption gives affection to a child. Families show their love through affection. It is a major decision in anybody's life. Choosing to adapt is a significant decision. It is a very good, important decision-making process. Openness, it opens your heart to the ideas. It definitely widens our thinking. It definitely breaks the margins and boundaries what we have with rigid values. And parents, there are new parents formed through adoption. Togetherness. Adoption brings families together. Inclusion. It creates an inclusive environment. And opportunity. Adoption offers a new opportunity for children. It nurtures, provide a nurturing environment through adoption. So I conclude my speech with this. Thank you for giving me this opportunity. Any questions? I create awareness. Whenever you get an opportunity, if you find an eligible parent who really wants to have a child, tell them that there is an option like this. That itself is something what we do for an orphan child. I request our chairperson ma'am, Mrs. Ritu Singh and Dr. Jasmine Santha ma'am to honor our guests with a memento. Thank you ma'am for the honor. I extend a warm and heartfelt welcome to Dr. Radha Ma'am, Principal, College of Nursing, Sanjay Gandhi Postgraduate Institute of Medical Sciences, SGBI, PGIMS, Lucknow. For this, I request Mrs. Chairperson Ma'am, Dr. Ritu Ma'am, and Mrs. Jasmine Sanja Ma'am, Principal, Suruchi Institute of Nursing, to offer the bouquet to Dr. Radha Ma'am. I would like to entreat Dr. Radha K. Ma'am, Principal, SGTGIMS, Lucknow, to please take our stage and disseminate her knowledge on congenital anomalies. Ma'am, you're cordially invited.
A very good morning to one and all present here. Good morning. Good morning. All is well? Yes, very good. So, first of all, I would like to thank Suchi Institute of Nursing, Management, Principal, and faculty and students giving me an opportunity to share my views in front of you. Thank you very much once again. With this, I will just go ahead for my presentation. Today, they had given us a topic of congenital anomalies. And we all know congenital anomalies, yes or no? Yes, sir. When you walk on the road or surrounding in any of the environment or neighbor of your home or at our home itself, somebody you might be noticed congenital anomalies, yes or no? Yes. So with this topic and with this title, I will go ahead with today's presentation. Just a second, please bear with me.
Hello.
Should we start? Yeah. Next, please. Can you identify this personality? The famous motivational speaker. Anyone? Can you guess who is this person? He is a famous motivational speaker without arms and legs. Both arms nahi hai, both legs nahi hai. Yes? So can we see that person? Nicholas. Yes? The famous person is Nicholas. He is a great motivational speaker. If you want to see in your YouTube, just see the video, YouTube and all. Nicholas, so he is a great motivational speaker. He has converted his anomalies into the opportunity. Yes? So this is what we want to know. The anomalous is not anomalous. Attitude, what we are showing, that persons are thinking that attitude is attitude. So how we are molding our mind, that way we can show our attitude. That the book also he has written. Attitude is attitude. So that is also we are going to see. So Nicholas James Ruchi, born 4th December 1982. He is an Australian American motivational speaker. And the tetra amelia. Tetra means 4, right? So both arms and legs he is not having. So even then he has converted. He is converted is the challenges, whatever the challenges converted into the opportunity. So he has a mouth. So automatically the nice speech has given, right? Knowledge has given. Why not converting this knowledge into the opportunity? That's what this PPT, this presentation is showing, right? Next one. Yeah. So here you just see in India also. So internationally we have seen India also the famous motivational speakers with their anomalies, with their malformations, dancer, musicians, singers, right? And video, matlab, cricket team maybe intellectual persons, right? So many areas they can shine. We may not think that only a nursing professions we can shine. Apart from the nursing professions also, we have knowledge, right? So we can disseminate with the technology advancement. The knowledge, the dissemination of technology advancement, definitely we can just change our paradigm shift in nursing, entire nursing professions, right? So a child born with any congenital anomaly evokes enormous feelings of anxiety and great guilt in the parents. Definitely, whenever the child we have at our home with mental retardation or congenital anomalies, heart issues, and CNS problems, right? So any of the issue, musculoskeletal, cleft foot, cleft palate, cleft lip, right? So any of the issues with the child is born, definitely it will be burden to the parents and entire family, right? Financially, psychologically, socially, emotionally, there are different aspects of the problems and issues the family might have seen, right? So this is what the introduction part. Next one. So what is definition of congenital anomalies? As per the WHO definition, congenital anomalies as structural, functional or metabolic anomalies that originate during intrauterine life and can interfere with the body functions. So it is a structural, right? Structural and functional or metabolic anomalies. It may be a different structural. When you see the club foot, that is structural anomalies, right? So next one it is a functional. Functional in heart में आप लोग सुना होगा PDA, patent ductal cardiac, right? DST, AST, these are functional malformations, right? And metabolic anomalies. Metabolic anomalies are Down syndrome, genetic or metabolic syndrome, right? So Down syndrome, trisomy 13, 21, Turner syndrome, Klinefelter syndrome. So many syndromes are there. So in this, the structural, functional or metabolic anomalies that originate. So कहाँ से आ जाते हैं? Intrauterine life से, right? When the mother is pregnant, from the pregnancy stage itself, from 3 weeks, say 8 weeks, Within that, majority of the anomalies are happened, right? 3 weeks to 8 weeks. Next one. So incidence, as per the WHO report 2023, an estimated 240,000 newborn die worldwide within 28 of days of birth every year due to congenital disorders. So more than 240,000 die within the 28 days of birth life. Within the 28. And 170,000 days within 1 month to 5 years. So within the 5 years, majority 50 years. So 50 years means you are everything the same. Everything the same. Strong foundation. Very nice. So third and fourth year. Right? So you are familiar with this topic. Yes or no? Yes. So incidence in India, relative incidence. Relative incidence means as per the system which affects the congenital anomalies. CNS system 7.6 per thousand. Thousand birth, there are 7 to 8 children are born with a CNS disorder. Like neural tube defect, right? So the commonest CNS is neural tube defect. So neural tube defect because of what is the reason? Neural tube defect? Iron folic acid deficiency, right? And musculoskeletal system 6.6 cleft foot, right? And talipes, so 6.6 children are born with the musculoskeletal anomalies, and CHD cardiac problems 2.7, GI problems 5, genitourinary 3.9. So this is a system-wise relative incidence and risk in India. So what is congenital anomalies? Have you all gone through this one? It is a biochemical, structural and functional disorders present at birth. So from intrauterine itself, the continuation of the structural, biochemical or genital, whatever the disorders or malformations, dysfunctions are there. Congenital malformation, it includes only the structural defect present at birth. So this is malformation. Malformation means formation itself the problem. Right? So when the malformation, it is the formation itself, it has some sort of defect because of the genetic reason or either the environmental factor. So malformation, it is a maybe formulation itself it is the problem or is the partially developed, partially formulated. Right? So this is called malformation. And disruptions. Disruptions, morphological alteration of already formed structure. Disruption is already formulated, right? So the cells or tissue, one or tissue may be affected, right? So formulated already, embryo, from the embryo it has formulated, developed, but in the developmental stages there is a problem, right? So this is called a disruptions. So this is bowel disorders or esophageal atresia, right? So these are the disruptions. Next one. Deformations, so abnormal modification of normally formed structure due to intrauterine factors. For example, oligohydramnios, because of less amniotic fluid, so there is a pressure in the musculoskeletal system. So this also one of the reasons, right? So this is the deformation. Dysplasia means abnormal tissue formulation, abnormal tissue development. So dysplasia, this matlab, so abnormality, right? So plasia means placement, abnormally placed in somewhere else, dysplasia. So causes and risk factors, if we see causes and risk factors, 25%, about 25% are environmental factors. So what are the environmental factors? I will just explain it. And genetic factors about 15%, unknown or multifactorial factors 40 to 60%, right? So what are the genetic factors? Genetic factors, it is number one is chromosomal anomalies. A minority of congenital disorder are caused by genetic abnormalities. For example, trisomy 30. Trisomy 30 means which syndrome? Down syndrome. Down syndrome, right? So trisomy 30 it is a Down syndrome. So it is a chromosomal anomaly number one. Because of what is the reason, main reason for chromosomal anomaly? consanguinated marriage, right? Consanguinated marriage मतलब क्या है? What is the meaning of consanguinity? Relatives, right? Within that relatives itself they will marry, right? The couple. Environmental factors, the main cause is pallid. कहाँ से हम लोग drugs which will cause intrauterine से problem आ जाएगा, anomalies आ जाएगा. It will impact in the intrauterine itself. Thalidomide in 1960 they had given for the pregnancy mother to induce the sleep, right? To induce the sleep they had given thalidomide drug. So thalidomide drug, what happened after given? So they had legs, arms damaged, ears, heart, kidney, and genitals. Majority of the congenital anomalies had happened after thalidomide drug, right? So that drug also will causes congenital anomalies. The concept it has emerged from this thalidomide drug. The first 1860. 60s, around the 60s, they had given thalidomide in the area of countries Europe, Canada, and South America. So the concept had emerged from that area itself. The drug is also caused congenital anomalies. So thalidomide is one of the majority of the causes for congenital anomalies. Next one. Alcohol, we know it is alcohol. Even mother whoever consuming alcohol, it also causes congenital anomalies. Smoking causes congenital anomalies, right? And impaired mental. So this alcohol, when you consumption of alcohol, it leads mental retardation, impaired motor coordination, poor attention, memory, language ability. These are some of the symptoms if a mother have the consumption of alcohol or smoking. Tobacco, and I said already the smoking, tobacco, alcohol, right? So these are the environmental factors. And who are socio-economic factors also? Lithium. In early pregnancy, heart malformations due to the lithium intake. Cocaine also. So these are the environmental factors. Smoking, alcohol, tobacco, toxicity of any drug, right? So these are the environmental factors which leads to congenital anomalies. Industrial solvents. So industrial solvents, even if you just see the Indian biggest industrial disaster, where it has happened? Where it happened in Bhopal gas tragedy, right? Methyl isocyanate gas, it impacted a lot because of that also. It 1984, right? In the year of 1984, it was the greatest industrial, even Asian level for industrial disaster. So due to that, the majority of the congenital malformations also happened. The research studies are true, right? So this is like industrial also it causes and industrial solvents, right? Chemical solvents, that is also one of the important environmental factors which leads to congenital anomalies. Next one. Maternal infections. Maternal infections, you might have studied TARS, right? So what is the expansion for TARS? Toxoplasmosis, rubella, yes, here, yes, simplex, yes, everything is in this slide itself, right? So rubella virus, cytomegalovirus, H. simplex, varicella virus, HIV, toxoplasmosis, and syphilis. So TARS, maternal infections also which leads to congenital anomalies. So genetic factors, environmental factors, unknown factors, right? So these are the main causes for the congenital anomalies. Hormones also, androgenic agents and diphthyl and maternal diabetes. See, this is the maternal diabetes. Maternal diabetes, if the mother is having maternal diabetes, definitely the chances of neural tube defect or heart, right? Serious problems, serious related congenital anomalies, the event or the rates of the incidence is high due to congenital diabetic mother, right? So let me see common congenital anomalies in the system wise also, and I think this is it's relevant to your subject. What it is theoretical, more theoretical. but I don't want to make more theoretical. Only the preventive part, what we can do for congenital anomalies, right? As training, prevention, because your this national conference itself, it gives the embraces to enhance neonatal care, child care, right? So this is, I just did more theoretical common congenital anomalies. Cleft lip and palate. What is cleft lip and palate? Right? What is that mouth we can? Lip means it is the incomplete closure, right? Incomplete closure of the lip, right? Or palate area, right? So this is what? Cleft lip and palate are congenital deformities due to failure of various parts of upper lip and palate to fuse in a normal manner, right? So this is cleft lip and palate. Sometimes the child will have cleft lip or palate or combined. Majority we can see cleft lip and palate combined, right? So the cleft palate, we can just make it 1 year before speech defect have developed. Cleft lip is operated about 3 months, right? So again, the slides also cleft lip and palate only. Next. So this is the slides again, it is showing cleft lip and palate. So umbilical hernia. So the next congenital anomaly is umbilical hernia. What is umbilical hernia? The protrusion of the intestine through the opening, right? Sac, right? So umbilical hernia. So the protrusion at a portion of intestine through the umbilical ring, muscle and fascia surrounding the umbilical cord due to imperfect closure of weakness or weakness of umbilical ring. So umbilical ring weakness के कारण so the protrusion आ जाते हैं, right? So this is called umbilical hernia. Next one. So next is skip later on. So next one it is congenital hypertrophic pyloric stenosis. Pyloric कहाँ है? Where it is located? Pyloric sphincter. Anyone? Upper stomach. Lower stomach. Junction कहाँ है? Where it is located? Anyone? More interactive so that I can just discuss you all because like one way speaking. Pyloric कहाँ आ जाते हैं? The portion between exactly small intestine and stomach. Where it's exactly located. Other in front. Pyloric sphincter, the junction between duodenum and stomach. So this is where you have said it very good. So it occurs frequently. So the pyloric sphincter stenosis also, the congenital anomaly. It may be many reasons, unknown reason also, and the genetic reasons and environmental reasons. Right? Next one. Surgical treatment. Later. Next. So phimosis and paraphimosis. Phimosis. What is phimosis? Exactly, urethral opening, the central portion of the penis should be there, right? So instead of the central opening, it may be in a ventral side or lateral side, right? The opening may be in a different placement, right? So this is called phimosis. Clear? So phimosis, it is the tight foreskin. The foreskin are released. Yes. So it is the tight foreskin being pushed up and constrict the circulation. So paraphimosis and phimosis, it is the tightness here. So inability to retract. Phimosis, inability to retract, right? So that will be the phimosis and paraphimosis. Next one. Next. So have you might have noticed clubfoot, I think. So common congenital anomalies whenever in the musculoskeletal system, right? Or else in the brain or spinal cord, like a spinal cord, spina bifida, right? Meningocele, myocele, brain and skull. we can commonly notice by our own eyes, right? But serious system, pulmonary system, genitourinary system, we may not notice on our eyes. We need investigations. Deeper investigation is required. Yes. So commonly club foot and all we can notice it and we can identify this is club foot. Yes or no? So club foot is the deformity in which an infant foot is turned inward. So inward flexion, right? So this is club foot, and club foot also there are different criteria are there. So that's why in this way we can grade the club foot also. Next one. So treatment it is the when the child is born with club foot. हम लोग घर में करा देते हैं थोड़ा सा मसाज करते हैं ऐसा नो. What else you know about the club foot? Anything else? Anything else? Club foot में कराते हैं क्या करते हैं? Yes.
मैम विद द हेल्प ऑफ पेंडुलम से हम इसे टाइटली होल्ड करते हैं ताकि मैम उसकी डायरेक्शन जो है वो चेंज हो सके.
Yes. Very nice. Very nice. So ये लोग क्या करते हैं पहले एक मसाज बोलते हैं because all muscles and everything ठीक होना चाहिए. And he was telling that bamboo stick में थोड़ा सा but हम लोग traditionally करते हैं it is not correct, right? But it required the yes. स्प्लिंट लगाते हैं, राइट? स्प्लिंट हम लोग घर में हम लोग रेमेडियल मेजर्स के लिए लगाते हैं इट इज आल्सो गुड बट इट इज नॉट एग्जैक्टली करेक्ट. इट नीड्स द इन्वेस्टिगेशन, डायग्नोसिस and the medical treatment also. Treatment is required, the surgical requirement, right? Surgical treatment is also required. So club foot हम लोग diagnose करते टाइम when we are at home or any surroundings में हम लोग देखते हैं थोड़ा सा आप लोग स्प्लिंट लगा दो, बांध के रख देना, immobilize कर देना तो नीट हो जाएगा. मतलब inward flexion it may come into the normal position, right? So that way we are doing it, but it needs some sort of investigations and the surgical treatment also if it is required, the extensivity of the club foot, right? Next one. Central nervous system में anencephaly, absence of the skull, right? Anencephaly, meningoencephalosis. So central nervous system again it is spina bifida, meningocele, meningomyelocele. This D picture you just see the neural tube and the meninges. It protruded. Yes or no? So the protrusion of the nerves and the meninges. Dono it is the protruded. Meningomyelocele. Next one. So this is again the meningocele and meningomyelocele. Hydrocephalus, microcephaly, small head, right? Microcephaly. Next one. Again, this spina bifida. I have shown the picture. Spina bifida. So it is a malformation of the spine in which the posterior portion of the lamina of the vertebra fails to close it, right? So the fails to close. Spina bifida spine में vertebra हो जाते हैं. It fails to close it. So that the protrusion हो जाता है, meninges protrusion हो जाता है. The gap it is there in between the vertebra, so it will be the meninges or the covering layer also will be protruded. According to that, we can say it is a spina bifida. Spina bifida occulta, it is the tuft of air will also we can notice and temple also we can notice it, right? Occulta and meningocele, meningomyelocele. Next one. So this slide should keep the same. Next one. Meningomyelocele, you have noticed the picture also. Next. Hydrocephalus. What is hydrocephalus? Hydro means water, right? So the excessive CSF fluid, right? Accumulation in the where it is vertebral 4 areas. So CSF, what is the normal amount of CSF fluid for adult? How much? Per day, how much? 720. So that is secretion or absorption? Secretion. So absorption around 150 ml, right? So this is excessive. If it is absorption, if it is not functioning well, so the excessive accumulation of CSF fluid will be there. So that is called hydrocephalus. Next one. And some of the congenital heart diseases I have listed here: ventricular septal defect, atrial septal defect, patent ductus arteriosus. Patent ductus में four conditions will be involved, right? Patent ductus arteriosus, coarctation of aorta, transposition of great vessels, tricuspid atresia, aortic stenosis, pulmonary stenosis, palate tetralogy, mitral and aortic regurgitation, dextrocardia. So the question of the cardia is indifferent. So, right, dextrocardia. So these are commonest congenital heart disease. So Epstein anomaly is also there. This is also congenital heart disease. Abnormal tricuspid valve, abnormal small right ventricle. You just notice that ventricle is very small, right? Hole are defecting atrial septum. So the condition it is involved in Epstein anomaly. This is also the conditions under which the congenital anomalies of the CVS system. GI abnormalities, tracheoesophageal fistula and esophageal atresia. So this is also grade A, B, C, D, E. Up to E, there is in the figure there are different cadres where you can see that the tracheo and esophageal fistula. Fistula means, what is the meaning of fistula? Abnormal connection between two, right? Two organs, right? So here tracheo and esophageal fistula. Trachea and esophagus is different system. Trachea is the respiratory system, esophagus is the GI system. Yes or no? So in between there is a connection. So tracheo-esophageal fistula. This is also in the intra-uterine life there is 6 to 8 weeks. Around 6 to 8 weeks this may be arising, right? So the tracheo-esophageal fistula. Next. GI system, another pylori stenosis and duodenal atresia. Meconium ileus, epiphresis, that is congenital megacolon. Megacolon means, mega means it is an enlarged colon. Examples and gastrocneusis. Next. Diaphragmatic hernia and umbilical hernia. I have just explained already, right? Diaphragmatic hernia and umbilical hernia. Then respiratory abnormalities also. Some of the respiratory abnormalities also will be there. That is the co-anesthesia and pulmonary agenesis. Pulmonary agenesis matlab not developed. Genesis matlab development. Agenesis matlab not developed. Pulmonary agenesis. Other respiratory abnormalities: tracheoesophageal fistula, congenital atelectasis, congenital stridor, and congenital cyanosis. Genitourinary system, again renal agenesis not formulated, right? Agenesis renal, absence of kidney, right? Renal agenesis, hydronephrosis, water collection, right? Next. Hypospadiasis. What is hypospadiasis? Hypospadiasis and epispadiasis. These are also congenital anomalies. Abnormal opening of the urethra, right, in the ventral portion, right? So hypospadiasis and phimosis I have already explained. Undescended testes. Undescended testes, it is failure to descend the testes, right? Undescended testes and hydrosis. Other genitourinary system abnormalities: posterior urethral valve, congenital inguinal hernia, malformation of reproductive organs. So these are some of other like more theoretical part, the congenital anomalies as per the system wise. And then we have noticed already club foot, right? Talipes equina varus, right? Next. Congenital dislocation of hip, dislocated hip baby. Polydactyly, syndactyly. Polydactyly matlab, what is polydactyly? Extra fingers. Poly means extra, right? Dactyly means fingers. So extra fingers. This is webbed fingers. Webbed means fusion, right? Not separated properly, webbed, right? So syndactyly, right? So the name it is syndactyly and polydactyly. This is also the commonest musculoskeletal anomalies. Next. Muscular dystrophy, congenital scoliosis. Scoliosis means, what is scoliosis? स्पाइन कैसे होना चाहिए? स्ट्रेट होना चाहिए. Scoliosis means lateral curvature of the spine. Yes, scoliosis is the lateral curvature of the spine. So this is also, and osteogenesis imperfecta, bone is not developed. Next. And thalassemia, hemophilia, sickle cell anemia, and congenital spherocytosis. So thalassemia means, so HB is very less, thalassemia. Very hemoglobin count is very less. This is blood disorder, right? The genetic linked autosomal linked disorder. So here thalassemia, hemophilia, and sickle cell anemia, some of the blood disorders. The hemophilia में blood clotting is very less, right? Next. Metabolic disorders, cystic fibrosis, G6PD deficiency, that is glucose PD deficiency, phenylketonuria. This is metabolic disorder. I have already said the causes for congenital anomaly is, one is genetic, right? Then metabolic, right? Environmental factors, unknown factors. So these are the congenital metabolic disorders. Present disease, glycogen storage disease, inborn errors of metabolism. So here congenital hypopituitarism, dwarfism. You can notice dwarfism also, very short stature, right? So dwarfism, congenital goiter. Next, this is dwarfism, very small stature, right? So pituitary gland. Right. And other endocrine abnormalities, congenital hypothyroidism, cretinism, congenital adrenogenital hyperplasia, diabetes mellitus. Chromosomal abnormalities, the Down syndrome, trisomy 21, right? Edwards syndrome, you can see small mouth, small jaw, short neck. Neck also you can notice it's very short neck, right? And you can just malformed ears also, clenched hands with overlapping fingers, fixed big toe you just see toe also, prominent heels, right? So this is Edwards syndrome abnormalities. And intellectual capacity is also very less, Edwards syndrome. Turner syndrome and Klinefelter syndrome. So it is a Turner syndrome में one X means XX means it is a female, sex linked or right, sex linked chromosome. इसमें absent हो जाएगा. Klinefelter में male child will get X extra, right? So Klinefelter में, so that the male will get the female dominance, androgen will be less. The egg growth will be more in Klinefelter, right? Fetal alcohol syndrome, the consumption of alcohol any time during the gestation period can damage the baby's brain, right? So this is fetal alcoholic syndrome is the commonest cause because of the mother's consumption of alcohol. So this is some of the signs fetal alcohol syndrome characteristic by this is epicanthal fold, low nasal bridge, short nose, thin upper lip, small chin, indistinct plectrum, flat mid face, low set ears, minor ear anomalies, short palpebral fissures, microcephaly, small head. So these are some of the symptoms of fetal alcoholic syndrome. Next. Cerebral palsy. So cerebral palsy also it is which affects the way of the brain and control the muscles of the body. Cerebral means brain, palsy means weakness, muscle weakness, right? Down syndrome I have explained already, right? Multiple sclerosis is a central nervous system disorder marked by decreased nerve function with initial inflammation of protective myelin nerve, covering and eventual scarring of symptoms and severity of symptoms. So multiple sclerosis, when the child is grown up, the condition worsening is worse, right? So multiple sclerosis. So when the child is grown, the worsening of the condition is worse. Multiple sclerosis. Next. Another congenital cataract, congenital glaucoma, color blindness, congenital deafness, mental retardations, congenital biliary atresia. So these are the other congenital anomalies, right? Along with this listed congenital anomalies. Microagnata, cleft lip. So again the pictures is repetitions for your revision only, cleft palate. So we have to see whenever the child for assessment. So this is the previous slide. Bacterial the mnemonic terms, like for example, vertebral malformation, anal atresia, cardiac defect, tracheoesophageal fistula, renal abnormalities, lymph abnormalities. So these are the some sort of assessment we have to do when the child is or the mother is prone to this, right? So the bacterial assessment also we need to do it, right? So prevention. So only the conditions in congenital anomalies we cannot treat completely the extensivity or the severity of the congenital malformations or anomalies. So what we can do it, we can prevent. So in the prenatal itself, intranatal itself, and postnatal itself, there are different kind of preventive aspects are there. So that we can reduce the birth of congenital anomalies. So genetic counseling. So one important one is genetic counseling. So mother, those who are doing the consanguinity marriage, right, relative marriage, we have to discourage them not to do it because many of the congenital anomalies, the risk is prone for them. Consanguineous marriage. Discourage consanguineous marriage. Avoid late marriage after 35 years. The risk of congenital anomalies is more, right? So 20 to 35, 21 say 35, the risk of the born child with maximum the less chances of congenital anomalies. But if the age is advanced, above 35, or when it is double, triple, when and even the birth of the child also. The first child, second child, the birth order of the child is also. When number of pregnancies is increasing, the congenital chances of congenital anomalies is also increased. Previous slide. Previous slide. So promotion of the health of the girl child and pre-pregnant health status of female by prevention of malnutrition, anemia, folic acid deficiency, iodine deficiency, right? So screening we need to do it. Encourage the immunization of all female child by MMR, protection of individual and whole community against mutagens, X-rays, drug alcohol, the radiation exposure, the avoidance of the alcohol, right, and the drugs. So these also one of the preventive methodology to reduce the congenital anomalies. Then immunization by anti-T immunoglobulin by Rh negative mothers after abortion, the frequency of abortions or subsequent abortion. Compulsory we have to do complete screening. Next, elimination of active and passive smoking of tobacco by mothers. So whatever the kind of smoking, alcoholism, exposure to drugs, teratogenicity, right, X-rays and other things, chemicals, we have to avoid it. So that is the condition in the preventive aspect. Next. Avoidance of drug intake without consulting physician, prevention of intrauterine insertion, yes, TARS, I have listed TARS also, efficient antenatal care, promotion of therapeutic abortions after prenatal diagnosis, discouraging reproduction after birth of a baby with congenital anomalies, increasing public awareness. So we have to promote non-nursing professions. We can just, whenever you are going for community posting, right, clinical posting, we have to encourage the awareness camp also to screen congenital anomalies, and those who are prone to risk of getting congenital anomalies, we have to screen, and we have to create, sensitize the awareness among them, right, so regarding the congenital anomalies. Next. So prenatal diagnosis and postnatal diagnosis, what we can do to do congenital screening, anomaly screening. So when 4th month to 5th month, anomaly scan, right? Have you all heard anomaly scan? So anomaly scan we have to do it. the fourth month. So before fourth, third, fourth, fifth month, reaching to fifth month, we have to do congenital anomaly scan also. Prenatal diagnosis, amniocentesis at 14 to 16 weeks. This is invasive procedure, right? Amniocentesis, chorionic villus sampling, maternal serum alpha fetoprotein and the gonadotropin, USG, amniography, fetoscopy, protein assay, DNA diagnosis, radiography, antenatal screening. See, these are the things those who are high risk mothers. High risk mothers, we can do chorionic villus sampling and amniocentesis, right? So if it is the normal mother, we cannot promote you go for chorionic villus sampling or amniocentesis. Whenever we know it is the mother is prone to get congenital anomalies, history of the genetic problems or history of the previous mutations or anything else, so that way we can just suggest to do the screening procedure. And the purpose, you know, it is the cytogenic study, neural tube defect, the fetal profile, shock to tissue abnormalities, well-being of the fetus. That's why just we are doing the diagnostic procedure. Next is screening postnatal diagnosis. Next, physical examination, biochemical assay, cytogenic test, hormonal assay, radiography, USG. So this is postnatal. When the baby is born, we need to do postnatal diagnosis also because we know it is the mother is familiar to have a congenital anomalies or previous history of any of born child with the congenital anomalies. So we have to track in prenatally and postnatally the child is born with the congenital anomalies for early treatment, right? So we have to do postnatal diagnosis also. So this is all about screening. Prevention is better than cure. Yes or no? So congenital anomalies, once if you born child with making the burden to the family and entire society, instead of that we can just prevent and screening also we can do it. So that way we can just reduce the risk of congenital anomalies. So with this note, I just always remember that you are absolutely unique just like everyone else. So we are unique. Everyone is unique, yes or no? So I am standing my color, my height, and the speaking abilities, communication abilities, or whatever it is, the distance between others, I am unique. So always we have unique. So we are seeing that always we say that I don't have this one, I don't have this one. Yes or no? We are telling so many excuses. It's not like that. You just remember the congenital anomalies, the child is born with congenital anomalies, or disabled children. They are converting their challenges into opportunity. Why not we? Right? So with this note, I want to conclude my congenital anomalies. Thank you. Thank you for that. Thank you to the management, British College of Nursing, and the principal have given me opportunity. Thank you once again. Thank you, children, for your patient listening. Thank you.
I would request our chairperson ma'am, Mrs. Ritu Singh ma'am, to offer our guests with a moment. I request our principal ma'am to offer the bouquet to ma'am. Ma'am, please do the honors. I request Dr. Jasmine Santha ma'am. I request Dr. Jasmine Santha ma'am, Principal, Surunji Institute of Nursing, to offer the bouquet to welcome our next guest, Dr. V. Subirtha ma'am, Principal, College of Nursing, Command Hospital. We welcome you ma'am with a floral bouquet. Audience, you are requested to please maintain the decorum of the audience. Please, committee members, please look over this. Next, I would like to request Colonel Dr. V. Sukrita Ma'am, Principal, College of Nursing, Command Hospital, CC, Lucknow, to please take over the stage to impart her knowledge on unseen prospects of infertility. Ma'am, you are accordingly invited on the stage.
Good morning to you all. I think students बहुत थक गए हैं. सब लोग अपने जगह से खड़े हो सकते हैं? Can you all lift your hands, stretch your legs, say hello to your friends? I think during the second also you are saying hello.
Students who are requested to please maintain the decorum. What ma'am is saying, just listen to it.
अभी एक बार हेलो बोल लीजिए एक दूसरे से. So that we all can concentrate. Okay. Hi, hello. Yeah, please sit down. I know that you all are excited, and at your age we were also like you. But then even I was listening to Madam the previous talk. It was so very informative to me also. So people take a lot of effort to prepare. So I would request to pay attention, and these kind of workshops happen with great difficulty, lot of hard work, paperwork, coordination. So I really congratulate Dr. Jasmine and her entire team and the Suruji management for organizing this wonderful workshop, because it is touching some of the very key aspects which are very relevant to all of us, and as students and as healthcare workers for all of us. So enjoy this session. We will have an interactive session. As the previous speaker also had an interactive session, it is good when you contribute and make it more interactive. Okay, so the topic given to me is unseen prospects of infertility. So, how many of you know infertility? You all know what is infertility? Yes. Okay. So, even as I start this session, we will interact more. So here, Radha and Ravi recently got married after a long courtship of 2-3 years, and they are beginning a new life together. And I know जब शादी करते हैं तो बहुत सारे ड्रीम्स होते हैं, बहुत सारे एस्पिरेशंस होते हैं कि हम ये करेंगे, ऐसे करेंगे, फैमिली इस तरह से प्लान करेंगे, है ना? हर व्यक्ति का ड्रीम होगा, आप सबके पास ड्रीम होगा कि कोर्स खत्म करने के बाद में probably you may have some friends you may be thinking कि चलो मैं इससे शादी करूँगी या इससे शादी करूँगा and हम इस तरह की जिंदगी जिएंगे. लेकिन शादी होने के बाद जो है something is missing. Okay? Sometimes there are personal problems. Sometimes everything is good. Students maintain silence. Okay. So sometimes everything is good, right? Then what man has been created for, that is procreation, that doesn't happen. So when you investigate such a thing, then lot of problems, lot of pressure. All of you know Indian society has got lot of pressure. So there are so many consequences which are seen in infertility and which are unseen in infertility. आप सबको पता है कि स्त्री को स्पेशली इन इंडियन सोसाइटी बांझ कहते हैं, बांझ कहते हैं और बहुत सारे अगर जब बहू घर में लेकर आते हैं तब सब लोग यही एक्सपेक्ट करते हैं कि 1 साल 2 साल जो भी उसके बाद एक बहू जो है एक बेटे को जन्म देगी या बेटी को जन्म देगी, तो दिस expectation is there. So there is lot of psychological impact when a person is unable to conceive or procreate. Okay. So what is infertility? All of you know. Infertility is basically inability to conceive. Okay. And this can be divided into two. You can have primary infertility or secondary infertility. It's easy to understand. Primary infertility is the inability to conceive after 1 year of unprotected intercourse for a woman younger than 35 years of age, or after 6 months of unprotected intercourse for a woman over 35 years of age. And secondary infertility is the inability of a woman to conceive was previously able to. So आपका पहला बच्चा है लेकिन दूसरा या तीसरा बच्चा आप कंसीव नहीं कर पा रहे. Next. So the etiology of infertility is multifactorial. There can be female factors, male factors, unexplained factors, and certain other factors. This is the percentage of factors. Next. Incidence of infertility. All of you know that in the present scenario, आजकल लड़कियां जल्दी शादी नहीं करती, लड़कियां लड़के दोनों जल्दी शादी नहीं करते. सबसे पहले सेटल होना चाहते हैं, जॉब चाहिए, बंगला चाहिए, गाड़ी चाहिए. ये सारी चीजें होने के बाद में एक अच्छा पार्टनर भी मिलना चाहिए, उसके बाद शादी करते हैं. ऐसे टाइम पे क्या होता है कि बहुत सारा डिले होता है और आजकल ये देखा गया है कि इनफर्टिलिटी का इंसिडेंस जो है वो बहुत ज्यादा हो गया है. और इंडिया में अभी रिसेंट न्यूज़ में मैं देख रही थी इनफर्टिलिटी इंसिडेंस लास्ट ईयर के कंपैरिजन 0.9% और बढ़ गया है. Okay, so infertility is increasing worldwide as well as in India. Next. Okay, so here how do you determine infertility? It is based on India's total infertility rate, and what they have seen is that it is fallen by 19%. साल में 19% infertility का रेट जो है वो increase हो गया है और सबसे ज्यादा 28% in Punjab, 5.6% in Kerala, then Maharashtra, Rajasthan and so on. Statistics से मैं आपको बोलने next. So what is fertilization? हम बार-बार infertility बोल रहे हैं, तो what is fertilization? Fertilization is known as conception. Okay, known as conception, and basically it is the fusion of a genetic material from the haploid sperm and the secondary oocyte to form the zygote. So zygote is the primary thing from where the embryo will develop, and this process takes about 12 to 24 hours, and it occurs in the ampulla of the uterine tube. Next slide. Yeah, so there are certain factors which are favorable for fertilization, and certain other factors may be there which are not favorable. What are the factors required for conception or fertilization? It is the spermatozoa, then capacitation and acrosomal reaction. You know that when the sperm moves, it goes and breaks the shell of the egg and enters it. So basically, that capacitation should occur. Then the sperm should be motile. If the sperm has to travel, it has to be motile, occur properly, so that a good egg is produced, and there has to be patent fallopian tubules. तो ओवरी कहाँ पे बनते हैं? ओवरी में जब ओवम बनता है, उसके बाद वो स्पर्म से कहाँ मिलता है? Tubes में. So patency of the tube is very important. Then the endometrium also should be receptive after all this process has happened. Next slide. So let's talk about female infertility. It will be easy for you to understand if I discuss female and male infertility separately. Female infertility, next slide. There are certain factors or risk factors rather which increase the risk of female infertility. So सबसे पहला है age. Who can explain what is the relevance of age? Next slide. क्या होता है जब एक फीमेल के बहुत सारे ओवम प्रोड्यूस करने की क्षमता होती है, तो जब एज इंक्रीज होता है उसके बाद क्या होता है? वो क्षमता जो है वो कम हो जाती है. तो 20 to 24 में जो क्षमता है वो सबसे ज्यादा है, और as the age progresses, that ability to produce healthy ovum keeps on decreasing. So after the age of 35, a woman's fertility decreases rapidly. Next. Next slide. Then there are some ovarian factors which can cause infertility. So in that, the first one is anovulation. Anovulation का मतलब क्या है? Anovulation. Yes, one person. What is anovulation? Anybody?
Absence of ovum.
Yes, correct. So when there is an absence of ovum, okay, and this can cause because of various factors. So for the ovulation to occur properly, all the hormones have to be correctly balanced. Okay, so there can be ovarian factors. There can be decreased ovum. When the female child is born, she has got a reserve. So if that reserve itself is low, then the healthy ovum production is difficult. Then the luteinized unruptured follicle. So if the follicle doesn't get unruptured, then again fertilization is very difficult. Then there are other factors like tubal and peritoneal factors. In tubal factors, basically, if the tube is not patent, there can be problem. Like if there's a surgery and the tube becomes impatent because of adhesions or healing by fibrosis, so that can be a problem. Then infiltration of the tubal mucosa, tubal endometriosis, and so on. Next. Peritoneal factors. So peritoneal factors, there can be it can be because of previous abdominal surgeries or surgeries of the endometrium. Then uterine factors, all factors which interfere with the resection and nigration of the fertilized ovum, all fall under the uterine factors. Then cervical factors. Cervical factors you can divide into anatomical and physiological. Anatomical cervical factors are those where which affect the anatomy of the cervix. Physiological are those like where there is purulent discharge or any other physiological factor that is affecting the cervix. Next. Then comes vaginal factors. In vaginal factors, you can have very narrow introitus. Because of this narrow introitus, proper intercourse cannot happen, and it can have septum, it can have atresia. So these are vaginal factors. Then there can be some combined factors like genetic factors, infrequent intercourse or intercourse not happening during the period when fertilization can occur. So in and around the period of ovulation, if the intercourse is not happening, then fertilization cannot happen. And some people also use certain lubricants. Okay, so certain lubricants are used for increasing sexual pressure, but then that can actually harm the sperms, and that is why the fertilization may not occur. Next. Common causes, other causes, these are the other causes. I will explain in this slide in detail. Next. Next slide. Okay, endometriosis, the first one. So endometriosis, all of you know that this occurs when the uterine tissue implants and grows outside of the uterus. So there can be scar tissue formation and blockage, and there is a 25 to 35% rate of infertility in people who are suffering with endometriosis. Next slide. Then pelvic inflammatory disease. So infection causing inflammation, and pelvic inflammatory disease is one of the very common female genital tract inflammations and infections, which includes endometriosis, salpingitis, mucoovarian abscess, and peritonitis. So जब भी infection या inflammation होता है तो उस वक्त fertilization ठीक से नहीं हो पाता है. There is development of scar tissue as well. Next. Then coming to uterine fibroids and pelvic adhesions. Fibroids, very common. Yes or no? Fibroids are very common and they are benign in nature. So, is there a pointer? No problem. So here you can see some of in the diagram, some of these fibroids are there. They go and occupy the body of the uterus, and thereby the person becomes infertile. If these fibroids are very big in size, there may be heavy bleeding and also inability to conceive. Then pelvic adhesions are actually bands of tissues which may block as a result of some surgeries that have happened or infections and then healing when it occurs. So that can lead to pelvic adhesions. For example, appendicitis, the complicated appendicitis surgery has been done, or abdominal or pelvic surgery has been done. उसके बाद क्या होता है जब वो healing होता है तो adhesions हो जाते हैं. वो adhesions क्या visceral organ को ऊपर से घेर लेते हैं and then that can cause infertility. Next. Then ovarian failure. Now ovarian failure बहुत कारणों से हो सकते हैं and it can be a consequence of medical treatment or the complete failure जिसमें ovaries कोई ovum की नहीं बनाता. For example, Turner syndrome, मैडम ने already previous speaker ने explain किया है. So as a result of treatment, cancer chemotherapy, for example, or any long time treatment for arthritis and other medical or surgical conditions, when a woman takes treatment for long time, then she may have an ovarian failure. Basically, any treatment which can destroy the eggs. Next slide. And hormonal issues. Hormonal issues, it can be ovarian disorders, elevated prolactin level, polycystic ovary syndrome, and early menopause. We will see one by one. Next slide. Next slide. So, for example, elevated prolactin. This is also called as hyperprolactinemia. So, it can cause irregular ovulation or no ovulation in certain women. It can also cause irregular periods, may cause galactorrhea. What is galactorrhea? Students, what is galactorrhea? Yes? Anybody? So production of milk or secretion of milk in the absence of pregnancy. Okay? So next one is polycystic ovary syndrome, PCOS. नाम सुना है? It's becoming more and more common in the present generation, and here what happens is it produces too much of androgen hormones or male hormones. तो आप देखेंगे कि स्त्री में बाल होंगे और मेल फीचर्स होगा, वेट गेन होगा, तो these conditions are becoming common and that can cause an irregular menstrual cycle or absence of menstrual cycle. Okay, and this is one of the most common condition for infertility. Next. Then other cause, early menopause, or early menopause or absence of menopause, early depletion of ovarian follicles, surgical menopause in certain conditions where you have the person has undergone a total abdominal hysterectomy, जिसमें ovaries भी निकाल दिए जाते हैं, तो उसमें वो व्यक्ति surgical menopause हो जाता है उस लेडी का. That can be there. Then other causes are medications, thyroid problems, cancer treatment I've already explained, and there can be certain other conditions where either the puberty is affected or the person is having sickle cell disease, HIV/AIDS or kidney disease or any other major disease. Now coming to fertilization problems. So बाकी सब ये चीजें ठीक है और fertilization हो जाता है. Fertilization होने के बाद भी कई बार जो है वो आगे pregnancy carry नहीं होता. वो क्यों carry नहीं होता? There can be a reason called as anti-sperm antibodies. The name itself is very clear. Anti-sperm antibodies. So anti-sperm antibodies we क्या करते हैं? Anti means against. So once the fertilization occurs, these anti-sperm antibodies can destroy it, or it can destroy the sperm itself. Point 2 I have written, or it may neutralize the sperm by clumping. Okay, so there is a chemical reaction, and many women unexplained infertility. Many women is caused due to this. Then the second cause is oocyte membrane protein. So there are certain proteins that is required. That protein name is receptin. Receptin means something which the name itself suggests, something which receives. So this receptin अगर वो नहीं होगा, it's responsible for binding the sperm with the egg. If this protein is not present, then fertilization will not happen. Next slide. Then development problems. So certain development problems also hard होगा. अगर वो बहुत hard होगा नहीं कर सकता. So hard eggs and then these teratogens. Teratogens are what? They are external sources which can cause harmful effects. Teratogenic effect, carcinogenic, ये सब हमारे external environment से आते हैं. So this kind of teratogens which are basically happening because of X-rays, radiation and other viral infections, they are known as teratogens. So because of them also infertility in females can occur. Next slide. Now coming to male infertility. Any doubt in female infertility? No. किसी को कोई doubt है? नहीं है. So you all want me to finish faster? Okay, coming to male infertility. Next slide. Okay, male infertility में basically चार कारण बहुत common है. First one is defective spermatogenesis. Number 2, obstruction of the afferent duct system. Number 3, failure to deposit sperm high in the vagina, and errors in the seminal fluid. So one by one we will quickly see it. Next slide. So first is defective spermatogenesis. These are the main reasons why there is male infertility. So it can be because of congenital causes like undescended testes, hypospadiasis, and thermal factor. So can anybody tell how the thermal factor can affect? What is the location? Temperature? Yes, very excellent. So the temperature of the scrotum is lesser than the body temperature, and this temperature helps in production of healthy sperm. Okay. So people who are working in the kitchen, like people who have done roti management or chefs are there, those who are in the lorry drivers continuously working in high temperature or with machinery, they are more prone for having problems because the temperature is constantly high and healthy sperms are not produced. Okay. Then infections. Then there can be infections, especially mumps. Mumps is known to cause otitis and thereby affecting the production of sperms. Then gonadotropin suppression. So in chronic diseases, sometimes the gonadotropin hormone itself is suppressed. Then endocrine factors. Endocrine factors increased follicular stimulating hormone in testicular failure that can lead to infertility. Then loss of sperm motility. What is that called as? Loss of sperm motility. What is decreased sperm and what is loss of sperm motility? दोनों का क्या terminology? Anybody knows? Anybody? Students? Yes. Yes. You want me to repeat the question?
Seven is responsible for motility of the sperm.
Yeah. So if there is a decreased motility, what is it called? Anybody? Decreased sperm count, what is it called? Decreased or no sperm count? Yes? Yes? Very good. What else? What else? Okay, correct. So, we'll see in the next slide. Next slide. Okay, so if there is a decreased sperm count or decreased body fertility can, and you know that infection, so blockage will not allow move. Okay, the entire seminal fluid itself will not move and will not be ejaculated into the vagina. So, therefore, this can cause infertility. Then, failure to deposit sperm high in the vagina. For example, erectile dysfunction. Everybody has heard about erectile dysfunction. Ejaculatory defects because of some congenital malformations in the penis. So there can be ejaculatory defects. And you can have hypospadiasis. These all result in failure to deposit semen into the vagina. Then errors in seminal fluid, unusually volume, low fructose content, and undue viscosity. You all know this determines the thickness of any fluid. Okay, we talk about viscosity of that. Similarly, if the viscosity is very high, it will not move. The seminal fluid will not move. Now coming to investigations. So basically, investigations are done. Number one, detect the positive factors. Number two, to identify and rectify the abnormalities, and number three, to give the third objective to do investigations is to reassure, and then there is a possibility of couple conceiving, then you can reassure the couple. Next. And when to investigate? अभी शादी हुई है 80 साल हुआ है उम्र कम है तो you can still give them more time. You can reassure, you can give them certain tips of when the intercourse can happen and all these kind of things will be coming in the next slide. So all those education can be given to the couple. But in case the woman is more than 35 years of age or the male is more than 40 years of age, then you have to start the investigation because उसके पास age नहीं. Next. So what to investigate? Analysis, confirmation of ovulation and confirmation of tubal patency. Tubal patency is very important because any patency, if it is hampered, then the fertilization will not happen. Next slide. Students, please settle down. Clinical approaches to male investigation. So, for a male, first of all, you need to take history. History, taking me up medical history, surgical history, general history, any sexual history, any probability, any infections, all these things have to be asked from the patient. Then the next is examination. So in the examination, palpation is very important. Palpation and finding out the testicular volume is very important in patients. And presence of any varicose vein also to be done during physical examination. Next. And the investigations continue. Routine blood tests. Routine blood tests are done to find out if the person is having any metabolical problems, any comorbid conditions. So for that it is done. And semen analysis. Semen analysis, I am not going into detail of collection, but if you want to do a semen analysis, you have to tell the male that they will not have intercourse for at least 2 to 3 days prior to the analysis. Proper cleaning has to be ensured and collection of adequate amount of sample should be done for semen analysis. And next is serum, FSH level, LH level, testosterone, prolactin and TSH level. Then you may also do a testicular biopsy, transrectal ultrasound, vasogram and karyotype analysis and immunological test. Now vasogram is basically done to find out the patency. Okay, next slide. Then investigations in the female. The general history taking and physical examination remains same for the female also. Other than that, you have to ask for history of tuberculosis, because in tuberculosis, the female may be taking drugs, anti-tubercular drugs over a period of time, which may affect the fertilization. Okay, so STD, any pelvic inflammatory disease, and any treatment, any hormonal treatments, contraceptives, anything she has taken, all these things should be taken care. Then surgical history very important, because the uterus and in and around that area there should not be any adhesions. So if there are previous surgical history, then adhesions is a very common problem. So that can be treated by removing those adhesions and thereby aiding in fertilization. So that is to be found out. Obvious obstetric history, the previous obstetric history, whether it is primary infertility or secondary infertility, to find out that. Then contraceptive practice and any sexual problems between the couple. This is very important. Many times they start the investigation without asking any sexual history. So sexual history is very important. Whether the couple is actually having a proper married life or not. Are the intercourse happening at frequent intervals? It is recommended that during the period of ovulation, at least within a gap of 3 days, the intercourse should happen. And it should happen naturally and without any pressure. So many times what happens is the couple are not able to enjoy because of lot of pressure, societal pressure which is there, and they are so desperate to conceive that they are not able to enjoy, and many times there is tension which can cause various sexual problems. So proper sexual history is very important for determining or treating infertility. Then the other investigations in female is the speculum examination and cervical mucus study. This is also very important. Then hormone estimation, very important in females, because many hormonal problems can lead to improper formation of the ovum. It can also affect the fertilization. Even after fertilization has happened, if there are hormonal problems, implantation will not occur. So that is why it is very important to investigate all these things. Then ultrasound, laparoscopy, and other tests, and plus also immunological tests is very important if there are any immunological causes which are leading to infertility. Next. Coming to the treatment. Next slide. So the first and foremost thing is reassurance, because in our society the couple have lot of psychological issues, especially the female. always reassure, and we also see in our society कि सबसे पहले घर में जो लेडी को इन्वेस्टिगेट करते हैं. There can be causes in the male, but always the lady gets investigated first, and they say that मेरा बेटा normal है. तो both the couples need to get their investigation, and they have to be reassured. Body weight optimization. So obesity and underweight both are high risk, but obesity of more is of more risk. If both male and female are obese, they need to start losing weight, and thereby that can help them. Smoking and alcohol both have to be stopped, because females are also smoking nowadays. So smoking, alcohol in both couples have to be stopped. Then ideal vital frequency. I have already explained you that use of at-home fertility monitor. Some certain countries are promoting this. Then use of urine for optimum LH count presence and good ovulation. So during that time, if the intercourse happens, then the chances of fertilization increases. Then avoid lubricants can cause effect on the sperm. They can destroy the sperm. So all these foams, lubricants which are used for increasing sexual pressure should not be used by these couples. Then avoidance of anti-fertility medication, if any. So it is important to ask complete medical history intake of any medications. So thereby you can avoid these medications. And then psychological support. Next slide. Here again, similar factors, those for female factors, this is for male infertility. Again, alcohol, smoking, reduction of body weight, avoidance of warm and tight undergarments. I have already told you what is the importance of that. And avoidance of anti-spermatogenesis, drugs, and treatment of any other specific causes. Sorry, there is that H has to be, both H has to be small. Next. Then also checking the male for dopamine agonist for hyperprolactinemia. Okay, in males also there can be hyperprolactinemia. And if there is any altered endotestosterone of the levels, that is to be treated. And GnRH therapy for hypogonadism. Hypogonadism, the gonads are not well developed, so that needs to be treated. And then you can also treat with clomipene citrate to increase the follicle stimulating hormone and the luteinizing hormone and testosterone. And also antibiotics are recommended if there are any serious infections which are there, so that needs to be treated. And if there is any hydrocele or any other surgical problem, then that is to be treated by surgery. Next. Now, in management of female infertility, if there is a ovulatory dysfunction, that needs to be treated with drugs. And clomipene citrate, you all know, very commonly used drug used for ovulation induction. Okay, so that is that. Then, in case the person is very obese, you can use metformin. For commonly metformin is used because it also helps in reduction of weight as well as for blood sugar to bring the blood sugars low. Okay, then other surgical methods can be used for treating all these structural abnormalities. So surgical methods, especially removing of adhesions, and then anastomosis and improving the tubal patency is very, very important. Next. Okay. So these are the treatments. Supposing these treatments all fail, there are additional methods now, which is also called as assisted reproductive therapy. Means that there is manipulation of gametes and embryos outside the body using different techniques. किसने सुना है? Okay, IVF, very good. Anything else? Gift, very good. Anything else? Very good. Okay, so we'll see all these things quickly because you all already know. We can go very fast. Next slide. Okay, so the first is intrauterine insemination. So it is placing increased concentration of motile sperms close to fallopian tubes, bypassing abnormal endocervical canal. So if the cervix there are some problem or there is a problem in the endocervical area, then that is bypassed and concentration of motile sperms. Motile sperms are very important. So a concentrated fluid with sperms is kept inside the where? Inside the tubes. Okay, so that will help you in easy fertilization. So indications are hostile cervical mucus. We have already seen cervical stenosis. If there is a cervical stenosis, the sperm, the seminal fluid and the sperm will not enter into the uterus. Okay. So then oligospermia, everybody knows oligospermia. Okay, what is ethnospermia? When the motility is decreased, I had asked you that question earlier also. So, in all these factors, you can do an intrauterine insemination. Next slide. Now here, this intrauterine insemination can be done in two manners. Okay, you can take from donor. If the female patient is there, her husband is having low sperm count or unhealthy sperms or non-motile sperms, then you can take it from a donor. Okay, where I have written down untreatable azoospermia and ethnospermia. So, and certain genetic conditions, you can take this sperm from the donor. Okay, or else it can be done from the female's husband itself. So, the husband also can be taken and then you can try for artificial insemination. Next. So, here basically two things are done where what you can do is you can take the sperm and then place it for fertilization, or you may convert it into a gamete and then transfer it. Okay. So in vitro fertilization and embryo transfer, what indications are tubal block. So if the tube is blocked and you have tried all methods, then what you do is the technique is induction of superovulation by drugs. So then you pick up the egg. Then what you do? You retrieve that ovum and then you do the fertilization and then transfer the next body. Next. So there are two procedures. One is gift, another one is zip. Okay. So in gift, the gamete intrafallopian transfer occurs. So here the egg is separate, the sperm is separate. Okay. Both healthy ones are chosen and kept together. Whereas in the next one, both are brought together. The zygote is made and then it is transferred. So that is the difference between both the procedures. So gift is a procedure that involves ovarian stimulation. So first the female patient is given drugs for stimulating the ovary, mostly a mixture of sperm and eggs directly into the woman's fallopian tube. Okay, that happens. And here the problem is here, there is no confirmation of the fertilization. यहाँ पे सिर्फ egg को और sperm को एक साथ रखते थे, लेकिन there is no confirmation of fertilization. Okay, and the success rate is only about 28%. Next slide. So here what happens? Here it is called as a tubal embryo transfer. So what happens is here you take a healthy egg, you take a healthy sperm, you allow the fertilization to occur and then it is transferred. Okay. So fertilized eggs are placed directly into the fallopian tube and here the success rate is about 29% per egg retrieval. So here the fertilization is actually happening in the lab in a petri dish and from there it is transfer. Okay, next slide. Then the next is intracytoplasmic sperm injection. Okay, here the sperm is directly injected into the ovum or the egg. So that is called as intracytoplasmic sperm injection. This involves injection of a single sperm into an egg. The woman is administered fertility drugs prior to the procedure. This administration of fertility drugs happens in most of the procedures. Only active, undamaged sperm. So जो अच्छा sperm है उसी को आप select करते हैं and eggs also you observe and then after the fertilization happens, then it is implanted into the uterus within 72 hours. The success rate is about 15 to 35% per egg retrieval. Next slide. Now we have seen all these treatments, and in every treatment I told you that the ovulation induction has to happen or fertility drugs have to be given. So, what are the health hazards of artificial reproductive techniques? Number one, there are increased chances of birth defects because this happens, many things happens in the lab under artificial conditions. Then there are increased chances of miscarriage, ovarian hyperstimulation syndrome because you keep on stimulating the female system to produce more ovum. And it can lead to cancers, it can cause lot of psychological stress. Every time you stimulate, every time you take a egg, lady wait करती रहेगी कि इस बार हो जाएगा, इस बार हो जाएगा. So it causes lot of psychological stress. And another most frequent problem is multiple pregnancy, ectopic pregnancy and hypertrophic pregnancy. Anybody knows what is hypertrophic pregnancy? Yes? Anybody? Okay, I will explain. It is not very common. So hypertrophic pregnancy का मतलब है कि जब बार-बार ovulation तो pregnancy जो है uterus के अंदर में भी just tube or elsewhere in the body also it can happen. Okay, so that is hypertrophic pregnancy. Next slide. Now the prognosis of artificial reproduction techniques. Pregnancy rate within 2 years after start of investigation. So it is 20 to 40% chance कि आपका ART शुरू करने के बाद the व्यक्ति pregnant हो. Number 2, there is increased chances of, however there are increased chances of abortion. There is increased chance of ectopic pregnancy. I just now explained, and it also doubles the perinatal mortality. Next. So अभी ये सारी चीजें try कर ली. The next option, if nothing works, then the next option open to many couples are adoption. Okay, adoption. So adoption is a legal process in which future parents create relationship with the child. Okay, so that is adoption. Next. So there are various steps. आपको पता है कि adoption आसान नहीं है. पहले तो couple themselves they have to understand that they are no more able to have children. So they are no more able to produce children. फिर family को adopt करवाने के लिए समझाना पड़ता है. There are a lot of steps to be taken to decide the type of adoption, educate family members, educate the couple, prepare them well, okay? Investigate how to handle adoption, expenditure. आप adopt करना चाहते हैं लेकिन आपके पास पैसे नहीं है, तो adoption expenditure होगा, क्या step होंगे, legal procedure क्या होगा, ये सारी चीजें बताना जरूरी है. और ये बताने के बाद में finally the couple says yes and they are going to adopt, then the next procedure starts. Next slide. Now types of adoption. So आपने decide किया कि adopt करना है, तो there are different types of adoption. इसमें international adoption, infant to big newborn adoption, special needs adoption, related adoption, military and overseas adoption, and prenatal adoption. These are all possible. Okay, next slide. 5 minutes more only I am going to take. Please don't talk. Okay. International adoption. So international adoption is जब आप किसी दूसरे कंट्री से आप adoption करना चाहते हो तो उसमें laws बहुत ही stringent है. You can parents are not guaranteed a child. It takes more time. Generally you get orphans. Okay. And children are not newborns. जब दूसरे कंट्री से आप जब आप लेते हैं newborns मिलना बहुत बहुत मुश्किल है. अगर वो कपल चाहता है कि हमें newborn मिले हम उसकी शुरू से देखभाल करें वो मुश्किल हो जाता है. Okay, so waiting period is 12 to 18 months. Medical background or other background is not well known, and government paperwork is so much when there is an international adoption. Infant newborn adoption. This also takes a long time. It can take up to 2 years. Is the waiting period, and birth mothers are often involved in choosing the parents. Okay, so supposing you are waiting for a newborn child, so the biological mother is having complete freedom to choose the parents or to whom the baby is to be given. So that is again another problem. And relatively few infants are available through agencies, and prospective parents may use proper legal authority for adoption. Next. Okay, special needs adoption. ये special needs adoption उन बच्चों के लिए जिनमें बच्चों में birth defects है या other problems. So this can happen where people want to adopt or do a kind of a social service, and they want to help these needy children. So that is also possible, and this is a very difficult adoption. Children with special needs can be adopted. Next step. Relative adoption. Relative adoption में generally अपने relatives या पास वाले known people से adoption होता है. Next. Then military adoption. People who keep on traveling, they also can give their children for adoption. Again, military adoption and overseas adoption almost similar. Lot of paperwork to be done. Next. Now, issues to consider. Now, adoption. Even though we know that there are so many orphans and semi-orphans in India, in various countries, they are there, but then there are a lot of issues which needs to be considered. First thing is sibling relationships. Whether if the person is having one child, whether the other child, adopted child, will be looked after properly, whether there will be sibling rivalry or whether the acceptance will be there or not. Open adoption, birth parents contact with child. तो ओपन अडॉप्शन में आपको पता है कि ये इनके बायोलॉजिकल पेरेंट्स हैं, क्या वो उनसे संपर्क कर सकते हैं, कि बातचीत कर सकते हैं, मिलने आ सकते हैं. ओके, अटैचमेंट एंड बॉन्डिंग इसकी प्रॉब्लम हो सकती है. बच्चे को कई बार न्यूबॉर्न बेबीज को जब अडॉप्ट करते हैं तो उनको कब बताना चाहिए कि वो अडॉप्टेड बच्चा है या नहीं बताना चाहिए. लाइक दिस देयर आर वेरियस dilemmas also which are there, and other issues are different laws in different areas. Next slide. So adoption laws in India, there are various adoption laws. There is a Hindu adoption law. There are other adoption laws. So any adoption to be taken, it has to be within the purview of law. So nobody can just take a child and we want to grow this child. It is very, very difficult. So you need to undergo the proper legal process for adoption. Next slide. So this is the Hindu adoption law. A child legitimate or illegitimate whose parents are Hindus, Buddhists, Jains or Sikhs. So there may be religious bonding which is there, or the thing will be there that my child will go to another Hindu family only. So such things can be there. Next. Next. Next slide. So these are various adoption laws, and if you want to study more, you can look into this website, which will help you to understand the adoption in India. Next. Then comes surrogacy. Okay, surrogacy सुना है सबने? कौन कौन है बॉलीवुड में? प्रियंका, okay. Who else? शिल्पा शेट्टी, सोनली, okay. अच्छा नॉलेज है बॉलीवुड का. Okay, next. Next slide. Okay, so surrogacy is what? It is an arrangement in which a woman carries and delivers a child for another couple or another person. Next, mouse click कीजिए. Okay, so there can be traditional surrogacy. Next, gestational surrogacy, natural surrogacy or partial surrogacy. Now, traditional surrogacy में क्या होता है? Anybody? Traditional surrogacy where another woman carries the child, carries the baby, not the child carries the baby. The gamete or the sperm is from the husband. Okay, and gestational surrogacy, both sperm and ovum is from the parent, but the is carried by another person. Okay, same with natural or partial surrogacy, it's a combination of these. Next. Okay, so in this also full surrogacy, IVF surrogacy, it's basically the procedural difference that is there. IVF surrogacy, the fertilization and the zygote is transferred into the mother. Next. Next. So here what happens in genetic couples, the genetic material is from the couples and the pregnancy is carried by another person or the intended surrogate host. Next. Next. So indications. So who can go for surrogacy? Especially women who have undergone hysterectomy for cancer or postpartum hemorrhage or for menorrhagia or for any other conditions, severe associated morbidities are there, then they can that couple can go for surrogacy. Next. So surrogacy, whenever a couple is planning, you need to do a proper workup. Everything has to be done for surrogacy. Next. What is wrong in surrogacy? So many certain things don't come in this one. Like lot of issues are there in surrogacy. Like it is an exploitation of poor women. There can be lack of legal protection, health issues, unregulated. Suppose a woman becomes surrogate for many people, okay, and then shifting of focus. This is also again important that all focus is over the baby and not on the mother. Okay, and so there is money which is involved. Whether money should be paid or not paid, all these are issues that can come with surrogacy. Okay, here they are looking for a hopeful future, but then there are all these things. Some people come to India just to get a baby from a surrogate mother. And some people say the money that you get that can be used for upliftment or better. So women may be pressurized to take mother for another person for money. Next. So there can be psychological risk to the host, psychological risk to the person who is giving for surrogate all these problems can be there. So proper legal advice and all these things should be done with the legal power. Yes. So for the host also, lot of problems can a lady becoming pregnant again and again, or landing up with some other problem, or frequent breaks of abortion and so on. So the host can have multiple problems. Next. And there can be surrogate mothers who are related, like sisters, sister-in-laws, okay, stepdaughter, stepmother, and this is also happening nowadays. Next. An outcome of surrogacy. Many times, even though you may go for surrogacy, the outcome varies. Okay? So, live birth rate is about 37 to 43. Couple, there is chances of increased prematurity, low birth weight, VIH, first trimester bleeding, and spontaneous abortions, even in surrogacy. Next. And there complications. So after the baby is born, the host wants to keep the baby. She becomes attached and she doesn't want to take the baby. Have you seen that movie? Anybody? Yes? Okay, there was a movie on this. Or soon after the birth, the doesn't want to give the baby to the so these all things can happen. Next. This was there in the news few years ago. So this lady, Kapila, she had pregnantly moved to a US couple and she died. Okay, so it was in the news. So sometimes pregnancy-related complications can lead to death of the surrogate mother. Next. So there are a lot of government initiatives. Okay. And these are some of the legislations related to surrogacy. This is out of view of this lecture, but I have just listed them. Next slide. Next slide. Okay, so we have come to the end of this section. So infertility is a very common and very significant problem, and it is increasing world over and also in India. And female and male factors both are equally responsible, and so it is equally important that both male and female are investigated properly, and treatment will depend upon the cause of infertility and varies from ovulation inducing drugs to surgery to ART to adoption to surrogacy. With this,
Now, I will request Dr. Anuradha Tripathi ma'am and Dr. Jasmine Santha ma'am to honor our guests with a memento. Thank you, ma'am. Today, we have come together to express our sincere appreciation towards our esteemed guests and our excellent speakers who have been pillars of support, sources of knowledge and inspirations for all of us. We are grateful for your gracious presence and valuable time.
Lunch hour is the best hour of the day. I believe in stopping work and eating lunch because a good lunch fuels productivity and sets the tone for the rest of the day. I request Dr. Jason Selva, Principal, Suruchi Institute of Nursing, to please accompany our delegates for the lunch. And I request all of you to please move forward for the lunch session, and the committee members are requested to please move forward. Students at the back, please move silently. To be assembled here for your post test.
पिछले बार तो बंद तो नहीं हो गया था आज नहीं वही चक्कर अच्छा है आज तो नहीं गए ना तो
हेलो
चलो
हेलो 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 जी हेलो 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 जी हेलो 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 जी हेलो 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 जी हेलो 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 Hello. Hello. Hello, check. Hello. Hello.
तुम कम बोला अच्छा हो गया मैंने पहले ही जाके गया मैं समझ गया था जुड़ी मैंने गया ना डॉक्टर तो पहले ही मेरे को
हाँ भैया एक काम और है यार
सर को पहले ही बोल दिया
Hello. Hello, check. Hello. 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 Hello, check. Hello. 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 Hello, check. Hello. Hello. हेलो हेलो चेक हेलो 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 चेक चेक हेलो हेलो
अभी तो खाना खाना दे रहे हैं ए बच्चों तुम लोग क्या कर रहे हैं? यहाँ बैठ के तुम्हारा टीचर जो ये लगा रहा है लगा पे हम तो सोच रहे कोई नहीं है अभी था ना तो नीचे हाँ हम यहाँ पर लगा रहे हैं पकड़े नहीं लगा इधर लगा यहाँ पे सामने हाँ नहीं बात इस पर लगा बस ये जो छूटा हुआ है इस पर लगा वहां तक लगा दो पूरा लगा रहे भाई आगे से थोड़ा छोटा छोटा बस या रहने दो मुंह से काटो ऐसे तो फट जाएगा पूरा उठाओ इसको नहीं ये खराब हो गया नहीं ऐसे तो खराब है इसके ऊपर आप लगाओ वहाँ पे लगाओ ये भी इसको लगाओ इधर भी पूरा लगाओ पूरा इधर कोई नैनीताल का बैकग्राउंड लगा
नैनीताल में नहीं कॉलेज
पूरा लगा इसको मैंने किया थोड़ा सा यहाँ पे तुम ले लो अंदर तक सीट तक लगा देना तुम इधर आ थोड़ा सा अंदर तक बाबा सीट तक दिखाई नहीं पड़ता सीट तक अंदर हाँ हाँ हाँ
तुम तो तुम दे देना और तुम्हारा चाहिए ना तो इसमें ले आए
जब पीछे जो है नैनीताल तक होने लगे बैकग्राउंड तब तक नहीं खिंचवाएंगे, पीछे बैकग्राउंड हटवा देंगे।
किसी को भी अपन देने के लिए दीजिए।
अरे तो बीच में दिए जाते हैं।
ऑनलाइन तो नहीं चल रहा है, लाइव तो नहीं चल रहा है, ये लाइव चल रहा है।
अभी समझ में नहीं आया कौन किसको दे रहा है।
ए सुनो सुनो लाइव चल आगे देखिए लाइव ये लाइव चल रहा है, आगे देखिए।
कोई बात नहीं, हमारा यही जो हम
आगे तो सर आप बताइए
अच्छा वहां पे
और सब देख रहे होंगे हम लोग
हां
आप भी से बता भी नहीं रहे हैं।
जानबूझ के
कोई यार रील देख रहा है,
वो बात अलग है
ऑनलाइन कोई नहीं,
ये कौन
यही है।
ताकि लाइव हम लोग ऐसे कार्टून की तरह काम कर रहे हैं
बस एक ही लोग सर हो गया
ये इधर आइए आप आगे
आदित्य की जो आ रहा है आदित्य खड़े होकर फोटो खिंचवा रहे, रिकॉर्ड भी हो रहा है। यार इतना डिलीट कर दे, इतना डिलीट हो जाएगा। तुम कर देना पूरा ना देना।
ये वाला पूरा नहीं लग रहा जितना हम ग्रुप में बात करेंगे
हाँ आप चाहे जितना खिंचवा लो, बस सरस्वती जी के पास में जाइए कोई लोग और सब चाहे जितना खिंचवा लो डायरेक्ट।
तो आप क्या आगे आगे बैठिए।
भैया अगर आपका एडिशन ना होती तो क्या करती?
तब आप देखते हैं।
अब आप देखते हो
भैया खींचिए
भैया
इनका नहीं फोन देखिए पहले तो बताइए उसके बाद क्या देखना
ये कड़े खिंचवा रहे हैं, ये ऐसे कड़े खिंचवा रहे हैं, ये सारे
आइए
फोन दिया था
सुपरमैन बना हुआ है बंदा।
आ जाइए अगर आप लोग भी आना चाहते हैं।
आ जाओ
फोटो ज्यादा फोटो ले
अभी आपके पास फोटो नहीं है, चलिए आप
ये जो फोटोज आ रही है ना, गूगल पर बेचोगे कम से कम 15 या 16 डॉलर मिलेगी। गूगल पर बेचने पर से मॉडल के फोटो बिकते हैं ना, आप लोग जो फोटो ले रहे हैं 15-16 डॉलर मिलेंगे।
आप हजार उड़ा रहे हो पर मेरा फोटो का इधर से अच्छा नहीं आता है, इधर इसमें अच्छा आता है।
खाना खा लेना चाहिए
भाई अभी यहाँ बांध तो बैठा आदित्य खाना खा लो जाएगा, फिर बाद में हम जाएंगे खाना खाने।
मॉडलिंग नहीं करोगे
पोस्ट
मिल जाएंगे कि नहीं?
पोस्ट लेना
खाना खा लो नंबर शेयर करो, नंबर होगा लेकिन अभी फिर से शेयर करूंगा।
कॉलेज वाले कितनी फोटो लेंगे नहीं?
कोई आप एक एक दे दीजिए नंबर।
भैया दीदी का टीवी बैठ के खींचिए, इधर आ जाइए। अड़काती भी है मैम, भैया इधर आइए, इधर बैठ के भैया नहीं आ रहा, भैया इधर आइए, कैमरा भी देखिए हमारी एक
ट्रेन भी लगा दी।
हाँ बस हम जा रहे हैं बैठने भाई बैठी तो ना है हम आप लोग
लगवा देंगे लेकिन कब लगेगी ये बात खत्म हो जाएगी।
लक्ष्मी आ रही है।
Oh my God.
आज ना बिल्कुल लगे तो सिर्फ हाईलाइट करके निकले ना सही बता रही हूँ। आज ही कुछ चाहिए तो नहीं। क्यों ना क्यों ना मैं यहाँ पर नहीं कुछ भैया मेरी भी चाहिए। अरे वाह भैया हो गया मेरे पास और तुरंत स्टार्ट क्या है आज ना तो सही बोल रही
वरना मिलेंगे
भैया इधर आइए सर का पूजा होगा तो भैया मेरी नहीं खींचेंगे
भैया मेरे
सब हमारे भैया मुझे प्लेलिस्ट वाले भैया विशाल का बैकग्राउंड बताइए
लगना चाहिए ना कि फोटो वैसा। अरे दादा
हंसी
सीरियस हम नहीं कर रहे हैं ये अंदर
आई कार्ड तो हटा दो।
हाँ हटा
मैम आगे बस 5 मिनट आइए मैम। हाँ हाँ ठीक है उसी को हाईलाइट करवा रहे हैं। अरे ये हमारा फोन 5 मिनट हो गया। हम अच्छा है दोनों के साथ ओके
ये वो वाला पोज है।
मैम आप मेरा दबाइए
आप एक प्लीज ले लो प्लीज
उसको डिलीट भी कर देना लेकिन
तो आपको नेट पे लास्ट टाइम लाइव नहीं चलता है
बाहर चल रहा है
अरे जल्दी करो।
इसके बाद मुझे मैं 5 मिनट चलिएगा 5 मिनट की दवाई
अब आप बताइए पोज को बताओ
तुम लोग क्या क्या बताएंगे?
ये जब ये आ रहे हैं सारे टीचर
जाओ तुम लोग जाओ यहाँ से
कौन है
जाओ
कौन है
शर्म आ रही है ऐसा करने के लिए ये कहाँ रखना है, हमारा बर्तन क्या है ना, जो कि नीचे नीचे ना आए।
तो हम बोलेंगे तो उसी यहाँ ये
अरे टीचर वहाँ वो है ना इसलिए तो हमें
आप बताइए कुछ, आप यहाँ पे बैठ करना नहीं।
आप मुझे तो पीछे से कह रहे थे कि सर अपने कॉलेज की होती है
करने को आता है। हो गया? हाँ, आप जल्दी से बोले दीजिए।
थैंक यू सो मच
काजल मैम, कुछ दिखाइए। मैम, सब खुद ही ना हो गया नहीं।
बाहर वाले टीचरों के लिए मैम हमने स्पेशल आपके लिए पता है
एक भिजवाई तो वो नहीं है, मैम इतना पसीने का हो गया है।
ऑलरेडी कोई बात नहीं
ये बताइए, खाने की कब चलेगी?
क्यों नहीं खा रहे ये सब वहाँ मेरे इतनी आज सारी निकाल कर टीचर है नहीं अलग क्वालिटी में फोटो भेजिए
अरे हम ये मुझे नहीं जा रहे
क्या मुझे पास में
नहीं
मैं
मैं
सुनिए,
हां
मैं देखो ना आपकी बैग में नाम
तो उससे ही करो
नीचे डाल दीजिए, क्योंकि हमने 3 हमारे वो 4 हम लोग पोडियम के पीछे व्हाट्सएप करिएगा, ठीक है, और डॉक्यूमेंट में भेजिएगा।
खाना खा चुके तो यहाँ पर भी कौन आ रहा है नहीं तो कोई तो भी यहाँ पे आएगा ना फ्रेंड्स के लिए तो खाना ही पड़ेगा ना क्यों ठीक है मैडम जी
आप किसी को बैठाइए आप लोग बैठ जाइए तो खाना खाना भैया दे दी आपने फोटो
नहीं अभी विकास में
दे दीजिए
काफी किसी आए पर चेयर नहीं है, थोड़ी बात करेंगे। इसमें अब क्या क्या बचा है मैम, आपने नहीं खाया?
अपना कोर्स टेस्ट बनाया फिर उसके बाद रिटर्न आंसर है
जाके खा के आ जाइए, क्योंकि
कल तक तो आ रही थी आज तो कैसे
हमारी ऑफिस में कोई खड़ी है
अरे मुझे सबसे जो